From the WDXY studios in historic downtown Sumter, At Your Service Home Care presents Medical Forum with moderator Jeff Reed.
Good morning on still a hot Saturday morning, Dr. Marr.
Hot week. It doesn't seem to be cool.
You think it's going to stop?
Yeah, maybe in October.
Well, glad to have you. Jeff Reed, I'm your host for Medical Forum on this Saturday morning. And want to thank Bynum last week.
Great session.
Well, we've got to have her back on, both her and Sandy, because
we didn't get through everything.
We did. And, I mean, she was fantastic. We've got a lot of responses with questions. And I think the biggest thing that I took from it is when you're going to get health insurance, you can't just decide. There's a couple of criterions, as she alluded to, that allow you to sign up for health insurance. But there's a period in which you're eligible to do it, but there's also a penalty that comes when you don't.
Absolutely, Jeff. Really important. You know, I really took away the fact that we've talked about this on the show before, especially we brought in all these local vendors, how important it is to stay local when you're choosing these services, reliable medical,
right.
Home health, hospice, transportation, which we might be talking about a little bit later today. But so important to have that.
We better be talking about it later today. Michael's going to punch one of us in the head. All right.
But so important to stay local with these services. If you have a problem with your insurance, if your agent is in Oklahoma, it's going to be a lot harder getting through that problem versus having Karen, who is right there at Bynum on Wilson Hall Road, to call and pop over and see.
It's a great point. And I think that if people think, well, I'll go to direct and cut out the middleman, as Karen alluded, it costs the same. So you might as well take advantage of the free service that she brings in. And I'll be honest with you, one of the things I did after we left, I have a 16-year-old, soon to be 17, and what turned into, in between shows, a 14 to a 15-year-old. So we talked about, even with our kids, having enough insurance. And I think that's what Sandy really echoed back, was that you guys, you may have a cheaper car or something like that, but definitely need to look at your insurance.
Yeah, we're not concerned on the road with the cars we're driving. We're concerned about the more expensive car right next to it.
Well, speaking of more expensive cars, our guest today is Michael Murley, and he is with Midlands MedTech. And we're delighted to have you here on a little early Saturday morning. Mike, I'm sure you're probably working all night, especially in this heat with ambulance and transportation. So that's going to be our theme today. And what's great about it, Dr. Marr, I think you've got a little bit of knowledge in the past from past jobs prior to being a physician. So I'm going to kind of sit back and get educated. But, Michael, thank you for coming here.
Thanks for having me on the show. I appreciate it.
Well, give us a little background on yourself personally and a little bit about your company, and then let's get into informing people about what all you do.
All right. Well, I'm Michael Murley, and I'm the director of Midlands MedTech, and we're a local veteran-owned transportation company. We provide services that range from wheelchair van transports to basic doctor's office, routine, repetitive transports like dialysis, all the way to on-demand, emergent, advanced life support stuff. So we have a full range of options for people. My background is prior Air Force, so I got stationed at Shaw Air Force Base. I'm from Jasonville, Indiana. If you ever Wikipedia, it's the only Jasonville in the world. So it's a very small place in the middle of a cornfield. So I was a firefighter at the Air Force Base down the road. It was a great job. When I got out, I continued in the fire service with the City of Sumter Fire Department.
Okay.
And that's how I kind of transitioned to the medical career field, because we would go out to car wrecks and we would cut people out of cars with the jaws of life. And that, I really like that more than fighting house fires. So I really got into patient care and wanted to help people out. So I transitioned into EMS, got my EMT, got my paramedic. I worked Richland County EMS. I worked for a helicopter company as a flight paramedic. And
that's got to be cool.
Yeah. It was
maybe we'll
really
bring
cool.
that one back around for people that, getting on a plane or a helicopter, an emergency. Continue on.
Yeah, it was a great job, and the best thing for me was the training and the experience. I was fortunate enough to get a civil servant job at Shaw, so I actually work out there full time as a civil servant, and I own my own company, and I'm one of the owners. I still work out there too, and it's great being at Shaw. You're serving those who protect our country, and I love it. I love being around the military and the aircraft stuff. I'm just into all that stuff.
Whenever, got a wife involved here.
Yeah, I got a beautiful wife named Amber. I got 4 boys. Right? Yeah, I got a 10-year-old, a 7-year-old, a 4-year-old, and a 1-year-old. So I've
at some point, that's going to be an expensive insurance bill.
It is. By Karen's number, I'll give you her direct line after this.
I got a great family,
awesome.
Great family unit here. My mom just moved down from Indiana, and the first thing I did was you got to find a good healthcare place. So I referred her to Colonial Family Practice. She absolutely loves it there. So that was great.
Fantastic.
And so what happened was I got that job at Shaw, and I wanted to start my own transport company because I saw what was out there. I said, man, we can do better than this. Everyone had the bare minimum DEC equipment, and I said, let's put everything on those ambulances that you could possibly put on there. And we landed an excellent med control with Dr. Clanton. Garrett Clanton's he's a physician at Toomey with the emergency department.
Yeah,
and so he's our medical oversight. And he also went through as EMT and a paramedic through med school, and he's also had some flight experience. So absolutely excellent resource for us as Dr. Clanton. So we kind of all teamed this thing up, and we put it out there, man. And I really consider the only competition we have is ourselves. It's a really high level of care that we're providing, and I have some of the best employees, absolutely, in the medical.
Now, you're located here in Sumter where?
It's on South Lafayette.
That's right. And what's a contact? What we got you? Give a phone number out there, and give on Lafayette. What number is that?
It's 187 South Lafayette.
And the phone number how to reach?
It's 803-433-4600, and we have 24-hour dispatching.
Well, when we started the show, Dr. Marr, we always kind of brief our guests and such, and you had quite a few compliments for Mr. Michael here at Midlands. From your experience.
Midlands has been fantastic in this community. Sumter's a little bit isolated. We're a ways out from tertiary hospital facilities like Florence, Palmetto, and Columbia. There's certain services that just aren't offered in Sumter. Emergency angioplasty, for instance, and we were talking about that a little bit earlier. And it is absolutely necessary for these emergent transports to occur very frequently, more frequently than anyone could imagine, probably sometimes up to several a day, to these facilities to perform angioplasty for patients who are having heart attacks. And Midlands is top at what they do.
Very good.
We have them in our office frequently.
It's amazing. If just looking back a few years ago, where we were as a community, a healthcare community, on these STEMI patients, the heart attacks, it was taking an hour and a half, 2 hours to get them to the balloon angioplasty to open those arteries up. And now, we're hitting 76 minutes from the first medical contact to the balloon being inflated. And that's from the Colonial Family Practice for Toomey. It's absolutely amazing. We've had, in the last year and a half, we've had 10 patients of the STEMI. We've had many more than that, but 10 of them have actually went into cardiac arrest during transport.
Tell you what, Michael, that sounds... we're coming up on our first break.
Sure.
And we're here with Michael Murley, the director of MedTech. Want to thank our sponsor, At Your Service Home Care. And I think that'll be a great way to parlay into our second segment, because when we're talking about angioplasty and heart problems, as Dr. Marr alluded, that needs some time. So we'll be back after this brief message. Want to thank our sponsors again.
Back with the latest in health and medical news on Medical Forum, presented by At Your Service Home Care, WDXY 1240 AM and 105.9 FM.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When you buy home and car insurance, you'll receive a multi-policy discount. And when you buy life insurance, you'll get a special discount on your home and car insurance. Auto Owners will save you money on all of the insurance you already have. Now that's good policy. This is Sandy Wilson with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
After my surgery, I heard my children discussing their fear for me to live alone. I wasn't ready to give up my home and freedom, so I called At Your Service Home Care, and now I have my own concierge. It's owned locally by medical professionals. They work with me to make sure that I recovered from my surgery. Now I can stay at home and I have a new friend that I enjoy spending time with. If I need help around the house or have insurance or legal questions or just getting to my hairdresser, they help me with it all. Call At Your Service today for your free consultation, 607-9677.
Reliable Medical Equipment has been locally owned and operated since 1999 and provides a full range of medical equipment and services. Our accredited facility has a fully certified staff, and we are here to assist you with all your diabetic shoe, custom bracing, and prosthetic needs. We accept Medicare, Medicaid, TRICARE, and most private insurances. We're located at 246 Broad Street. Call 934-9212 or 435-9927 for our Manning location, which is at 37 West Rigby Street. Voted Best Prosthetic and Orthotic Business for 7 years.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine, and they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
This is Medical Forum, presented by At Your Service Home Care.
And we're back on this Saturday morning. We're talking this week with Michael Murley from Midlands MedTech Transport Service. This session has been sponsored by At Your Service Home Care, your concierge steward guide to home care and beyond. It's interesting, Michael, about 2 or 3 months ago, to let everybody know how important the service is. 2 or 3 months ago, I was working on a Saturday in our urgent care, and a patient came in, and it was the typical stoic male who came in. And he said, "I'm having some indigestion, and my wife has drugged me in here." And lo and behold, he had blood work and an EKG that suggested he was having a heart attack. We called our associates up at Richland Hospital. They said, "Put him on an ambulance and send him up." We called Midlands MedTech, and I'm going to tell you, within 90 minutes of that gentleman leaving my office, the cardiologist had done the procedure, called me, and told me what he had done.
Yeah, it's absolutely amazing.
It is. It truly is. And we were talking about some of the things that Toomey had done to stabilize patients before transport that we're not even doing anymore because the transport times have gotten so good. And that's really, it's really a commendation to your company.
We've had, I mentioned just before the break, we've had over 100 patients, STEMI patients last year and a half. 10 of them actually went into cardiac arrest during transport. All 10 of them shocked, right back, full neurological recovery. We've had some that, we had one that was an elderly, female who coded in the elevator on the way up. And the crew was like, it's not going to work. She's not going to make it. And, the amazing thing is you'll go back to the hospital, back over to Richland, a couple days later in your next shift, and you'll see that person walking in the hallway. It's crazy. What we're doing now is amazing.
It truly is. It truly is.
Now, how many employees do you have? And let's talk about the employees a little bit.
Sure. Yeah,
and
if
you want to point one out or two, or someone someone calls in that they might get, and then let's talk about the area and the range of your service.
Okay. So we're currently about 60 employees. We have about 30 full time, 30 part time. We have employees that are just drivers. We have EMTs, and there's several levels of EMT up to paramedic. We actually employ a couple of nurses. If you are, let's say you're a dialysis patient, now with the new Medicare laws, you have to be very careful that you qualify for a stretcher because that bill could be put back on you if they deny the claim.
Let's slow down and talk about that because we've had dialysis on early in our show a couple months ago, and now we see, in fact, one's in my old building for Reliable. DeVita, and then you have Fresenius.
Yeah.
How do I qualify for your service? And do you guys offer just ambulance? So I know it's kind of a two-part question. One, let's stay with for a dialysis patient out there or someone who maybe has been diagnosed as a possible dialysis patient. How do I get that ride here with MedTech?
Basically, it's very complicated, but it comes down to, can you be transported safely by any other means?
Okay.
So if you can ride in a car to, say, go to the grocery store or get your hair cut, you're probably not going to qualify for a stretcher or an ambulance. You may qualify for a wheelchair van. So you might have to go by wheelchair, but that's only if you're unable to maintain yourself in a car.
Okay.
So it can be complicated to kind of work your way through these requirements. So what we do is we actually send a registered nurse to the person's house. They'll do an independent assessment. So they'll assess the patient. There's a 14-page document they fill out. And then they submit that to us, and it tells us whether or not they believe whether or not they're going to be able to ride either by wheelchair or by a basic life support ambulance or an advanced. And then we make a decision as a company whether or not we're going to provide the service.
Well, if you can, maybe mention a couple criterions. I'm very familiar with the dialysis, and we had a great conversation with Tina Sylvester, who's a social worker in that field, and talking about the 3 different types of dialysis. But I know when I go into a physician, particularly around 3 o'clock, there are your ambulances and other companies' ambulances. So if you had to say, is there one certain thing that takes you straight to go that, yes, he'll need an ambulance for dialysis, or is it kind of a...
Well, if you're bed bound, if you're not able to stand up without assistance, walk without assistance, let's say someone's had a stroke in the past and they're weak on one side, they're not able to... You have to imagine riding in the car or the wheelchair and someone puts on the brakes and they're not able to maintain themselves or grab themselves, support themselves, they will probably qualify for a stretcher.
Okay.
So that it's really about the safety of the patient.
Okay. Very good. So go back now. 60. We have 60 employees.
60 full time,
30 part time, 30 full time. Tell me about some of the services you mentioned about drivers, and you mentioned about.
Yeah. So part of this suite of services we provide, we have a really good point of contact for everyone is Darlene Pack. She's our operations manager. So she kind of oversees the trucks coming and going, the schedule. When we have new employees come in, she'll be the one that kind of gets them on their schedule and where they're working. And she can be reached at that same phone number for our dispatch. My partner is Todd English. He oversees the whole basic life support operation, which is about 60% of our call volume. We're doing just over 1,000 calls a month, and about 600 of those are BLS, repetitive routine transports. The other 400 are on-demand emergent transports, non-scheduled stuff.
Okay.
And then those are probably the 2 big ones. Fawn Hughes is our administrative assistant. She handles all the paperwork, all the QuickBooks, and makes sure everyone gets paid on time.
I like
so
that.
She's extremely important. Yeah, everyone loves Fawn. So the service we provide, we have crews that come in at 5:30 in the morning to do those early morning dialysis. That's a driver with an EMT. And if anyone out there is looking for a job, we are dying for EMTs and paramedics. I think everybody is. So that's a really good foot in the door in the medical career field if anyone's listening and they're looking for a career field to get in where you can really get your money back from the cost of education. EMS is a really good career field.
Is that right?
Yeah, it is.
While we're on that, because you might throw out some feelers. What does it take? Let's say I'm a high school graduate. Let's say I'm listening this morning and I'm laying there on my couch going, I don't know what I'm going to do. And I'm not sure I want to go to college and spend $200,000 and not utilize my money. What would be a step that you would recommend, Michael, for that person listening out there that is kind of in a threshold of what do I do next?
Sure. If you have a GED or a high school diploma or equivalent, you don't have any felonies, then you'll be able to get into a EMT program. So those are delivered in a couple of different ways. The community colleges provide those courses, and then you could also go to these community training centers. The one for us is located over in Florence. It's PD Regional EMS.
Okay.
So you can Google it. They can find it. There's also a place in Columbia, Midlands. That region over there has a community training center. They provide that class. It's about 4 to 6 months from the time you start the class till you're certified and ready to roll. And I can't remember how many hours of training it is.
As an EMT.
As an EMT,
yeah, not as
paramedic.
a paramedic. There are 2 levels of certification.
Yeah. The EMT from just foot in the door type stuff is about 4 to 6 months if you pass everything the first time through.
Wow. And then the world's your oyster a little bit. There's
well,
jobs
it's a foot in the door. Yeah. It's definitely a foot in the door. There's great like county services you could work for. Sumter County EMS is an excellent place to work. Tons of great experience you can learn there. And they offer state retirement. And that's a really good thing to get involved if you're going,
Michael, I think that's great for our listeners out there. And we're coming up on our second break. I want to thank our sponsors, Toomey Hospital, always out. We had Jeff Fallon a few days ago and had a great 5-miler. They got the golf tournament coming up and so I think things are looking up for Timmy. I feel good things coming around the corner. So, Michael, we'll be back. I appreciate you coming in, as we talked about on a Saturday morning. And we'll be back with our third segment on Medical Forum right after this.
We'll be back with Medical Forum, presented by At Your Service Home Care on Sumter's home for news, talk, and sports. WDXY 1240 AM and 105.9 FM.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine. And they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When you buy home and car insurance, you'll receive a multi-policy discount. And when you buy life insurance, you'll get a special discount on your home and car insurance. Auto owners will save you money on all of the insurance you already have. Now that's good policy. This is Karen Schwartz with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
After my surgery, I heard my children discussing their fear for me to live alone. I wasn't ready to give up my home and freedom, so I called At Your Service Home Care. And now I have my own concierge. It's owned locally by medical professionals. They work with me to make sure that I recovered from my surgery. Now I can stay at home and I have a new friend that I enjoy spending time with. If I need help around the house or have insurance or legal questions or just getting to my hairdresser, they help me with it all. Call At Your Service today for your free consultation, 607-9677.
Reliable Medical Equipment has been locally owned and operated since 1999 and provides a full range of medical equipment and services. Our accredited facility has a fully certified staff, and we are here to assist you with all your diabetic shoe, custom bracing, and prosthetic needs. We accept Medicare, Medicaid, TRICARE, and most private insurances. We're located at 246 Broad Street. Call 934-9212 or 435-9927 for our Manning location, which is at 37 West Rigby Street. Voted Best Prosthetic and Orthotic Business for 7 years.
This is Medical Forum, presented by At Your Service Home Care.
We're back with Medical Forum. Going to head into our third subject. Had a great ending to the second segment, so if you're just joining us, we're talking about all the jobs out there in the field in a world where going off to college doesn't always ensure getting a job and people not sure what they want to do. And Dr. Murrell, I know you got a little bit of this knowledge in the past, and Michael was just talking about starting off with it being an EMT and such.
I actually started my medical career as a EMT paramedic, and I worked for 2 years in Baltimore, Maryland, as a transport paramedic, doing very similar work that Michael's doing. It's a great career. It's a great path. It's a great start. It can be a foot in the door. It can be the beginning to a career, or it can be just a long, good career in EMS.
Now, we were talking about, a 4 to 6 month, Michael, I think you said on the program. Now, for someone to become a paramedic, we got a longer.
Yeah, it's about a 2-year program from the time you start to where you're actually out, treating patients.
That's great.
Hundreds of hours of training, hundreds of hours of internship in a hospital. They don't just cut you loose. There's a lot of stuff you got to learn.
But Midlands MedTech, you're a growing. You cover Sumter.
Yeah, we're covering Sumter, Lee County. We do some Clarendon County work. We are on the road all the time to Richland County. That's where
Columbia is obviously in your.
Yeah, we go we've gone as far as New York, Maryland, down in Florida. We've taken some long transports. We are routinely on the road to MUSC. We're constantly on the road to the burn center. So we go up to Duke a lot.
So Augusta,
yeah.
Center,
Those 1,000 or 1,200 calls a month, we're putting over 50,000 miles on our trucks every month.
Wow.
The numbers are just astronomical.
And how many trucks do you have that you can put on the road right now?
13. So 13 ambulances.
So we have 60 employees, 30 part-time, 30 full-time, always looking for more, as you said, as far as employees as you grow. and 13 ambulances, correct? Now, is there any other transportation that you also specialize in, or is it all ambulance?
It's the majority of it's ambulances. We might run about 40 a month on the wheelchair van. Okay. So it's just kind of a limited service we provide.
I gotcha. Well, Chris, your experience in this, how valuable is what MedTech does to your business from what you see from a physician standpoint?
Well, we do like the emergency transports we spoke about from urgent care. Actually, from my office, I've had heart attacks in my office that were needed to be emergently transported, which is absolutely imperative. But we do a lot of non-emergent transports, maybe just to Toomey Hospital. Patient might be on oxygen. Patient might have a little bit of an unstable heart rhythm and needs monitoring over. And we had talked a little bit earlier about cardiac arrest. And what cardiac arrest is when the heart stops. And when you have a cardiac condition, whether you have heart disease, your risk of cardiac arrest or your heart stopping is higher. And so if a patient needs to go to Richland, it is far safer for them to be in an ambulance with trained personnel, with the equipment needed to treat an emergency cardiac condition. The chance of survival is so much higher.
Well, let's do this. Let's take a patient through, Michael, if we can. Dr. Moore, you mentioned about at Colonial Urgent Care. You've diagnosed this patient. Michael, you now have shown up. Take us through what happens as for stabilizing the patients. We've talked about how, in the past maybe they've used a drug like Plavix to help, but you guys are so efficient right now that you can get them there. Now we get to, say, Richland. So kind of take us through. Let's see if we can maybe, if a patient's listening out there and they've thought they've had indigestion, Dr. Marr, and you've said, I'm not sure, and then some tests have come back that have given you cause for concern that it's time to send them to Columbia or wherever, and the call comes in. Michael,
sure.
You show up at Colonial, what happens?
It's really good we talk about it because it happens so fast, it's confusing to the patient. So we'll get just a real brief handoff from the physician. These patients are just unstable in general because they're having a heart attack. So we'll get a quick handoff. We don't worry about the paperwork. We don't worry about anything else. We get the doctor's permission to transport. We rapidly load them in the truck and we head down the road. And I'll tell you, we do everything we do is to reduce that time it takes to do the procedure in the cath lab where they put the catheter in. Mm-hmm. And so we'll try to get people's pants off of them. So I'll have, say, an older gentleman in the back of my truck. We're going lights and sirens, and I'm sir, we're going to straight to the operating room. I have to take your pants off.
I'm sure now he's panicking even more.
Oh yeah,
right?
Why are you taking off my pants? Well, you're going to surgery.
Yeah.
And so we'll even trim them up. We'll get them as prepped as we can for surgery. Maybe the physician didn't get a chance to start the 3 IVs, so we'll spend our time starting getting IV access so we can push the drugs. They'll give us orders for drugs, maybe pain control. We might give them some aspirin and some nitro paste if they need it. But that is based off of real quick, good communication when the handoff happens. And then we try to educate that patient during the transport while prepping them. Mm-hmm. And then when we get to Richland, we have staff that meet us at the ambulance bay. And they take us directly to the cath lab table with no delay at all. We just go straight in. We put the patient on the table, and as soon as they hit that table, they start the procedure. It's magic. It really is.
How long
magic.
does it take? Because you full lights and full everything.
The transport time is about 40 minutes, lights and sirens, as fast as you can safely go. The procedure depends on how complicated procedure is. They might have that. They might start it and be done in 10 minutes or 20 minutes, or if it's very complicated, it could take longer. But I don't know what their times are off the top of my head, but it's somewhere around the 25-minute mark is what their door-to-balloon times are.
So, catheter, right? So we're talking about when they come in now, we think we might have anywhere from maybe a stent to what could be a quadruple bypass, right? I mean, we just don't know until
the catheter's placed, the dye is injected around the heart. Again, we're looking at the blood supply around the heart, looking for blockages, and the cardiologist may say we can deploy a stent to repair this, or we need to open the vessel up, pull the catheter out, and the patient needs emergency bypass surgery. And I know of one case that's happened in the last 3 weeks.
Wow. All right, so now I'm the spouse. Can they ride in the ambulance? Do they need to travel? What do we do? And time is obviously the patient is the first concern?
The first thing we have to be concerned about with especially a STEMI patient or a head bleeder, a very unstable patient, is their condition could deteriorate rapidly. And you don't want to have a spouse in that situation where they're in the front and their spouse is coding in the back. That's not a good deal.
Right.
The other thing we worry about is them safely getting to the receiving facility. So we have to play it by ear. If it's an elderly spouse that might not know where they're going or how to get there, we might put them up front, seatbelt them in.
Sure.
We don't let anyone ride in the back, but they could ride up front, seatbelted in. But if they are capable of driving, we'll suggest it to them because we don't want them stuck over in Columbia.
Well, the concern is now they're going to be driving. I assume you are going fairly rapid.
Yeah, we're going lights and sirens.
Yeah.
Which, even with highly trained drivers, it can be dangerous. So, we have to make sure that we're trying to be as safe as possible. And but we also don't want them blowing through red lights behind us, with their flashers on. So we'll tell them, drive the speed limit. We're going to do our best to get them there as safe as we can. We suggest that they drive unless they can't. And if not, we'll take them.
What an ordeal. We're coming up on our end of this segment. Boy, the time just flies by. I'm always amazed. I want to thank At Your Service Home Care, your concierge, your steward, your guide to home care and beyond. And we'll be back right after this short message. Michael, thanks for all that information, and we'll keep gathering more.
Back with more on Medical Forum, presented by At Your Service Home Care.
Reliable Medical Equipment has been locally owned and operated since 1999 and provides a full range of medical equipment and services. Our accredited facility has a fully certified staff, and we are here to assist you with all your diabetic shoe, custom bracing, and prosthetic needs. We accept Medicare, Medicaid, TRICARE, and most private insurances. We're located at 246 Broad Street. Call 934-9212 or 435-9927 for our Manning location, which is at 37 West Rigby Street. Voted Best Prosthetic and Orthotic Business for 7 years.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine. And they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When your policy comes from us, it comes with something extra, a real person. Don't buy from an insurance company with an 800 number and a voicemail menu. Auto Owners Insurance operates exclusively through local independent agencies here to help you with all your insurance needs 24/7. Now that's a good policy. This is Ed Bynum with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
After my surgery, I heard my children discussing their fear for me to live alone. I wasn't ready to give up my home and freedom, so I called At Your Service Home Care. And now I have my own concierge. It's owned locally by medical professionals. They work with me to make sure that I recovered from my surgery. Now I can stay at home and to have a new friend that I enjoy spending time with. If I need help around the house or have insurance or legal questions or just getting to my hairdresser, they help me with it all. Call At Your Service today for your free consultation, 607-9677.
Now back to Medical Forum, presented by At Your Service Home Care on WDXY, 1240 AM and 105.9 FM.
We are back on this Saturday morning Medical Forum. I want to thank from Midlands MedTech, Michael Murley, the director of Midlands MedTech. And also want to remind people listening on Saturday morning here that it also replays on Sunday from 2 to 3. So, Dr. Marr?
Jeff, we're talking about this transportation, and I think a lot of people take medical transportation for granted. I think when medical transportation is thought about, everybody has the vision of the kind of old volunteer fire departments, which I'll tell you what, are still exceedingly important in most of these communities, especially rural communities. I know we support our local volunteer fire department, and if something happens at my house, they're going to be the ones coming out taking care of my family. So, again, volunteer fire departments are exceedingly important. But getting back to the medical transport that we're talking about, meaning the patient who is emergently transported from a doctor's office, from a hospital, is beyond the scope of the volunteer fire department, and we are absolutely dependent on these transportation companies like Midlands MedTech to do a good job doing that. I'll give you an example. I traveled overseas recently, and because I understand the concerns about international travel, medical transportation that can be affiliated with that, I actually took out a separate medical policy that covered medical care outside the United States, because my U.S. health insurance quite possibly would not cover an illness internationally, but also would not cover transportation if I needed it back to the United States. And I'll give you an example of that. You could be in a country, a Caribbean island, very popular travel destination.
The Bahamas. Everyone goes to the Bahamas.
Now, I'm going to tell you, if you have a certain medical condition in the Bahamas that can't be treated on that island, or maybe even a local island, you will need emergency transportation back to maybe Puerto Rico, maybe Miami, but stateside. Those medical transports would obviously necessitate a plane trip. Could be in excess of $50,000.
Yeah, easy.
And they're not going to say, hey, you can pay this over the next 50 years. So, again, I think this is an important concept for people to understand, maybe for international travel. But really, it leads us into what I'd like to talk about now, about how transportation is covered. It's not a free service. It's a very expensive service because of the needed technology to transport these patients safely.
Yeah, with us, we have, every insurance company is slightly different, but almost all of them follow the Medicare guidelines. So Medicare has allowables. That's what Medicare says, that if you are loaded into an ambulance for an emergency and taken down the road, they'll pay up to $500 or $700 for the load fee and then a certain amount of money per mile. The company like myself, we can bill as much as we want. We can charge $1,000.
Right.
And then we could charge $20 a mile if we want to. But we've realized that the gap between what Medicare pays, which is pretty much what everyone else pays, and what we're billing will be thrown back on the patient. So it's a balancing act. You don't want to bill less than what the allowables are, but if you bill too high, then you're putting a crazy financial burden on the patient.
Right. And we do that in the medical field that Chris and I are familiar with. So for somebody listening out there, if you just took a number of, say, the Medicare allowable was $100, Medicare would pay 80 of it.
That's right.
80%. So your patient would be in charge of the other 20, assuming they had no secondary, even though you might bill $200 because there's other insurances that'll pay higher than that. You're not trying to get more. It's just the way, and we all do that. Everybody in the medical field has to do it because it's a moving target with Medicare. But those people would owe the $20, given that example.
Right.
Does Medicaid pay for this? And what other insurances? Does Blue Cross pay for this? Is this something that if you're advising someone, Chris had mentioned about going overseas, it never even dawned on me going overseas to take out separate policies. So anyone listening probably just got a great lesson in something.
Call Karen at Bynum.
Yeah,
there
call Karen. That's right. That's right. But in my policy, is that something that let's just use a Blue Cross, and I understand Medicare. Does a private carrier generally cover your service?
Well, let's say you're at the local hospital, you're at Toomey, and they don't have the ability to take care of you, so they have to transfer you to a larger hospital, like say Palmetto Health Richland. If that's deemed an emergency by the physician, it's probably going to pay. It's most likely going to be paid because it's justified, and there's no other safe way to do it. But let's say you're at home and you want to go to a doctor's office visit. Unfortunately, those preventative medicine transports, they're not covered.
Right.
So you have to be very careful, because if you just call someone up and say, hey, I need an ambulance to take me to see my local eye doctor, you might get stuck with 100% of that bill instead of only 20% of the bill.
Well, let me ask you this then. It's 102 degrees out the last few days. I am quite certain there's been a lot of people, unfortunately, that don't have air conditioning. They get overheated. I in the hospital the other day, seeing a patient in the emergency room was overflooded. People use you as a transportation and they use the emergency room when they maybe don't have insurance. How do you handle that? Do you answer those calls when? Is there a dispatcher, whether it's, you mentioned the volunteer fire department, paramedics, Chris. Has this been a busy week for calls of people that maybe are overheated? You get them into the hospital and they don't have insurance. Is that just something you got to kind of take on the chin, or how does this work?
For emergency, non-scheduled transports, let's say Doc has one that's having chest pain, shortness of breath. He's got to get them to Palmetto Health, Richland, Toomey, whatever. Mm-hmm. We don't screen for insurance. So if it's an emergent, life-threatening situation, we don't ask about insurance on the phone. We do the transport. If it's a routine, repetitive transport, because right now that's what Medicare's focusing on for fraud, we have to verify insurance and make sure we're going through all the hoops, the bells and hoops and whistles, to make sure that we don't get stuck with a fraud claim or the patient doesn't get stuck with a fraud claim. So it's kind of two different worlds. You have an emergency side and a non-emergency side.
Well, if I'm sitting at my house tomorrow, say, and mowing my yard and go, oh my gosh, and I'm by myself and I grab my cell phone and call 911. Sure. Does that go to you, or does that go to a paramedic, a fireman? Do they then parlay that onto you and say, hey, we've got a guy down, let's get in the emergency room? How does that work?
For the vast majority of 911 calls, they all go to the Sumter County 911 dispatcher, and they dispatch out local fire departments and Sumter County EMS. We have a mutual aid agreement with Sumter County EMS. We have an excellent working relationship with Bobby Hinks, their director, and Dr. Lecker, their medical director. So we do about 20 911 calls a month. And so about 20 out of their 1,200 a month. So we do a really small, part of that. But we also provide on-demand services to doctor's office. So let's say you have a colonial family calls, they have that STEMI patient that's got to get out. We'll directly respond to that without the 911 service.
That's great. That's great that you offer that service. Michael, we're coming up on our last break. Thank you again for notifying us all about what all Midlands MedTech does, and we'll be back right after this message.
Back with the latest in health and medical news on Medical Forum, presented by At Your Service Home Care, WDXY 1240 AM and 105.9 FM.
After my surgery, I heard my children discussing their fear for me to live alone. I wasn't ready to give up my home and freedom, so I called At Your Service Home Care, and now I have my own concierge. It's owned locally by medical professionals. They work with me to make sure that I recovered from my surgery. Now I can stay at home, and I have a new friend that I enjoy spending time with. If I need help around the house, or have insurance or legal questions, or just getting to my hairdresser, they help me with it all. Call At Your Service today for your free consultation, 607-9677.
Reliable Medical Equipment has been locally owned and operated since 1999 and provides a full range of medical equipment and services. Our accredited facility has a fully certified staff, and we are here to assist you with all your diabetic shoe, custom bracing, and prosthetic needs. We accept Medicare, Medicaid, TRICARE, and most private insurances. We're located at 246 Broad Street. Call 934-9212 or 435-9927 for our Manning location, which is at 37 West Rigby Street. Voted Best Prosthetic and Orthotic Business for 7 years.
The doctor will see you now.
Are you new to Sumter or been here a while and in need of a new family health care provider? Look no further than the excellent care provided by the physicians and staff at Carolina Family Medicine. Carolina Family Medicine includes Dr. Philip Jansen and Dr. Tracy Ridgel, who both specialize in family medicine. And they're here to take care of you and your family, now accepting new patients. So call them today to schedule your appointment at 774-7425 or find out more at cfmsumter.com.
The doctor will see you now.
Here's a good policy from Bynum Insurance and Auto Owners Insurance. When your insurance policy comes from us, it comes with something extra, a real person. Don't buy from an insurance company with an 800 number and voicemail menu. Auto Owners Insurance operates exclusively through local independent agencies here to help you with all of your insurance needs 24/7. Now that's good policy. This is Bubba Johnson with Bynum Insurance. Call me for all your insurance needs at 803-469-3030.
This is Medical Forum, presented by At Your Service Home Care.
And we're back with Medical Forum. We're in our last segment. We'd like to thank our sponsor, Bynum Insurance. Go over and see Karen Schwartz for all your insurance needs.
And Sandy and Ed, all of them, even Byron, yeah.
Absolutely. We're here today with Michael Murley, who is with Midlands MedTech Transport. And, I think Jeff and I both learned a lot today. I mean, we've really teased out a lot of information that I was unaware of. And I just know from my experience how beneficial Midlands has been to my practice, colonial family practice, and emergency transports, and even just urgent transports. Michael, one of the things you were telling us, very interesting to me, is that you do backup for the 911 system, which is not typical of most private ambulance companies. That's in my experience, that's very above and beyond, actually. And so you're actually providing quite a service to this community, even above and beyond a private company. Yeah,
we have I can't stress enough the uniqueness of our relationship with Sumter County EMS, Sumter County in general, Sumter Fire Department. They are excellent to work with. Like I mentioned, Dr. Lecker out at Faster Care, he's their Med Control. Our Med Control, Dr. Clanton's with Toomey. We all mesh really well together. So they've looked at all of our protocols, give it a thumbs up. We've looked at all theirs, thumbs up. So we have a great working relationship with the county.
In 24-hour service.
We do. We provide
on-call service.
24-hour ALS trucks, advanced life support. We have ventilators. We have IV pumps. We have just about every DHEC-approved drug that's in the formulary. We have it on the trucks.
Yeah, you really have to look at the back of these trucks as a mobile intensive care unit. I mean, this is high-end technology. This is expensive equipment. This is as good as you can get for critical care as the back of any other truck is.
That's right.
And short of being in a hospital with staff of several hundred and multi-specialty, this is the best kind of care you're going to get, and it really increases the chances of survival when a critical patient is transported between facilities.
Mm-hmm. I was reading all your equipment out. I'm a novice in this. Cardiac monitors, multiple Baxter syringe pumps. Eagle unit.
Well, we actually upgraded our ventilators. We were using
ventilators. Those are not cheap.
No. We were using the Eagle unit vents. It's been around for a long time. Yeah. Great technology, full function vent, does assist control, SIMV, the different modes of ventilation, mechanical ventilation. But we've recently updated to these LTVs. It's like a laptop vent. It's smaller. It does the pressure support, BiPAP, CPAP, the assist control, SIMV. So they're full function ventilators. And they're in a small packet, so it's really good for transportation. The people come to work for us, and that just kind of blows their mind. Like, you guys have all of this stuff? Yeah, we got it all.
Now, is that something that sets you apart, or is that something that is regular? You have to have that, or no?
No, this is all above and beyond stuff. Yeah.
Wow. Well, I think that's big to know. I was looking at the hypothermia capable, the induced.
Yeah.
I mean, that's for cardiac arrest, right?
It is. Well, it's when you get them back, right? So they've been in cardiac arrest. We resuscitated them, and now they have a heartbeat, and hopefully maybe breathing on their own, maybe not. But we'll cool them down. So we're generally initiating that at Toomey, and then we're continuing that through the transport to the receiving facility.
Very good. Very good. Again, we're in, because we say Sumter, Bishopville, Florence area. But you can cover, you had mentioned, you even take patients to New York. So we have patients, I just got a call from a patient that's coming down from New Jersey. They needed something simple from us at Reliable Medical Hospital bed. Let's say that same patient decided to go back to New Jersey, but was not, as you said, able to sit up in the car, didn't have transportation. So someone could be transported from Sumter with your company.
We do.
The United States.
We've done it. We generally stand up a 3-man crew, a 3-person crew. Prior to the transport, we'll have an agreement with the person, and we'll say, hey, this is how much it costs for load fee and mileage. And if they say, yeah, we'll do it, we'll load them up and take them wherever they want to go.
Wow.
It's amazing. The one we did in Florida, I think it was down to Miami, and so they drove there was an elderly couple that actually had a medical condition while traveling. And so we had a person drive them back to Miami in their own car and then fly back. It was pretty neat.
That's fantastic.
Wow. we're here with Michael Murley, and we're starting to close down a little bit. Probably have 3 or 4 minutes left in our last segment. And, we like to, at this point, kind of recap a little bit for somebody who might be tuning in the last 10 minutes or so. Michael Murley here with Midlands MedTech on Lafayette Street. Got bukus of ambulances and 12, 13 ambulances constantly work well with the city. 60 employees. In fact, you'd love to even have more of those. And I think the one thing that I hope people listening out there who are looking at a profession, I think Dr. Marr, what an admirable profession. There's very few things that you can do that get the satisfaction, I bet, that you feel out of your job. I mean, you've kind of, because you're in this, and Dr. Marr, you see this, but when you're talking about you bringing somebody back to life and then talk about moving them on down the road and saying, hey, you just saved a life.
Yeah, it's crazy.
To be able to jump into this field and not only have job security, in demand, and be able to not put yourself $500,000 into a college debt, it's amazing. I mean, Dr. Marr, you'd mentioned that's how you started. And
EMS is a great career, again, from all the reasons that you suggested.
Yeah, and you can start off and then move your way up to paramedic and maybe get there in 2 years and be one of your staff. Give us some contact points again. The phone number, Michael. How do we get in touch with you if somebody wants to set up for their family? Obviously, a lot of yours, no one knows that they're going to need an ambulance tomorrow, and they may end up, let me ask you this: can they suggest to Midlands? Can they ask for Midlands? Can they say,
absolutely.
Hey, look,
patients have the choice.
Yeah, and see, that's something that we find in our business all the time. So I think anyone listening out there, the qualifications that you have, the staff that you have, and then all the equipment on board, not to dramatize, it could be a life and death decision. So you want to be able to ask for Midlands. Phone number of how to reach you if somebody wants to inquire more about not only possibly furthering their career from EMS standpoint and paramedics, but you also train people. We
do training. I forgot to mention training.
And why don't you do that here? You got about a minute, so give us a little bit on the training courses.
To contact us, the easiest way is call dispatch at 803-433-4600. And then from there, if you need, I'm an American Heart Association instructor. We have several other on staff, but we teach advanced cardiac life support, the ACLS class. We teach the pediatric advanced life support, PALS class. We teach the basic life support, which is your CPR class. And so we do all that training in-house. We do it a lot cheaper than they do it anywhere else in the local market.
Wonderful.
And we also do a monthly in-service training program, a continuing education program. We do difficult airway classes. We have a whole host of training. So if you got any training needs, I'm your man also.
All right, Michael Murley with Midlands MedTech, and I thank you on this Saturday morning. And again, anybody listening in, if you caught some of it or missed a part of it, catch us tomorrow, 2 to 3 on re-air on Sunday, and we'll see you next week.